Good morning. Happy Saturday, May 3rd. Dr. Stavros here, guys. You know me very well. Good morning. Good morning. Hope you guys are doing awesome. As the week has ended, now we're on the weekend. So a lot of us who are prepping for an exam like we know USMLE or any kind of an exam, we spend the time to review, but also if it's nice weather, you want to enjoy the time and relax, right? So I want to do a live Q&A this morning. Why not? I'm always up by 5 a.m. anyway. I get stuff done because I got to get stuff done. I figure let's jump on. I have tons of questions. I could only probably get to about a couple of them. People sent them in yesterday afternoon, yesterday evening, earlier this morning. So I selected a few to answer. So I will answer a few of those questions. And please feel free to ask questions if you like in the chat. By all means, love to answer what I can, right? Yeah. So, good morning if you're in my time zone, and good afternoon, good evening if you're in different time zones. The whole point is let's work together side by side to get stuff done, right? So please, ask any questions you guys have, and I'll do my best to answer as many as I can. So basically, what it comes down to is, as you all know, Dr. Stavros here, when I work with students, I mentor, I motivate, I inspire. We all need some motivation. We all need a lot of it. And it's hard, especially whether you're studying, balancing school, whether you are working hard in rotations. If you are home studying, it's an honor and it's a blessing, because many of you out there, I know many now that I'm working with, they really are working part-time jobs, full-time jobs. They are working in the hospitals, seeing patients, and then they got to go home and study. So when you hear people tell you step 2 is easier than step 1, 100%, right? It's easier because it's more clinical. However, if you're in rotations, internal medicine, pediatrics, surgery, OB-GYN, and so on, you could be probably in the hospital 7, 8, 10, 12, 14 hours a day, depending on how intense the rotation is. So then when you go home, you're responsible to then study for a step exam, ideally, right? So it's challenging, to say the least, but, we all want the easy fix. We want the magic pill. There's no magic pill, unfortunately. I like this coffee. 7-Eleven's good. 7-Eleven. I like blueberry coffee. The blueberry coffee is pretty good. So I'm a coffee connoisseur. I love coffee. Good morning, Chris from the Midwest, my friend. Coffee is awesome. I love it. I have coffee number 1, coffee number 2. I have a couple protein shakes over here. I have water, hydration. You got to give what you need. You got to feed what's inside you, right? So I can tell you one thing: when you wake up every single morning, you're blessed, right? You got to study. You got to keep pushing forward. So love that you guys jumped on a Saturday morning here. Beautiful. I have a couple of questions that came in. About 30 actually came in last night, but I only selected a few to answer because my time is also limited, right? So feel free. Here's a smiley face for me. If you have any questions, and again, you ask a question, how can I answer via text? That's why I open up my hours and I talk to my team. I said, I'll do my best to open up hours during the week, on the weekends, whether you're working with me in my live sessions, whether you work with me one-on-one, or you follow me, which I love, whether it's any social media platform. Thank you. It's an honor to have you guys part of my network and for me to be a part of your network. And that's why I want to open up these little Q&As once in a while, and also live session streams that I do talking about Q-Banks and about step 1, step 2, because I realize whether you are studying for step 1, step 2, DO school, chiropractic, any kind of exam, you need content and you need to do questions. I mean, that's what it comes down to. Whether you're a lawyer and you have to take the LSATs, or NCLEX for nurses, or COMLEX for DOs, or whatever the case might be, you have to study the content that's in your world. You have to answer questions because you got to get good at. You have to improve and do well in the questions that they're going to give you on your exam. And then you go ahead and you attack it and move on in your life. So, I mean, even though we're talking about medicine now, I have quite a few doctors and quite a few actually people reaching out to me. They go, hey, listen, I like your content. I'm not a medicine, I'm not a physician, but I don't know. I like what you say and I like how you say it. I'm like, thank you. I appreciate it because it's a small world from Peru. Hello from Peru. Very nice. Very nice to see you, my friend. Thank you. Very nice to see you from, I believe, YouTube. So thank you. Thank you. Yeah. So that's why, the way I look at it is years ago, we weren't able to communicate with too many people. It was a couple forums online. 10 plus years ago, we had limited amount of resources. Now I can get on live now and talk to everyone that follows me in the world, whether you're a friend of mine, a colleague of mine, whether I've worked with you, whether I some people we never really met, like during the pandemic. I met many doctors through the pandemic that were good friends today. Never saw each other in person, but we can talk. We talk on the phone. We communicate. We help each other out, consult and whatnot when it comes down to certain things we have to talk about. So use this to your advantage, meaning when I ask you, you have questions. I want to get 100 questions, not just 30 or 40 or 50, so I can figure out how to answer them for you, because I need you to be on the same page as me and the students that I work with. So if you are struggling, you shouldn't be struggling, right? Cool. All right, I'm going to answer a live question here before I jump into the list of questions that I have. Dr. ends in Yorgos, so that's good. Avierino Yorgos. Good morning, Stavros. You probably get this one often, but how many months do you think are needed to pass each step? Okay, good question. Because everyone is on a different level, meaning a medical student studying, in med school. You could be a physician that you just finished med school and you're practicing, or whatever the case might be, meaning in your country, or you are out of the loop for a while. I will give you an idea of a baseline of a study plan of someone who is a medical student or someone who can dedicate 8 hours a day, right? Okay, that's fair. So if you are able to dedicate 8 hours a day, this is for you. If you clearly are working or in school or rotations or lab or whatever the case might be, occupied or preoccupied, clearly it's going to take you longer. Okay. Step 1, 3 to 4 months. Step 2, 2 to 3 months. And step 3, about a month. Now, that is a short answer. Clearly, there's a lot more to that, right? So, unfortunately, you have to take some things into consideration, right? The basic science, the material. Are you decent in the content? Okay. So if you know the material, you just got to answer questions. Awesome. But what if you're a good test taker, but you don't know the content? Or your content is okay, but you're not really seeing enough cases, meaning questions. So you would ideally give 3 to 4 months, 3 months average for step 1, 2 to 3 months for step 2 on average. And then step 3, when you are in residency, that's a whole different ball game. Usually it's about a month or 2. Now, just so you know, the running joke in the USMLE world was this. Step 1, 3 months. Step 2, was it 3 weeks? And step 3, 3 days. This is like when I was in medicine. That really doesn't work in today's world. But yeah, man, reach out to my team if you want, or email us, support@usmletrainings.com if you have any further questions. But typically you have to give yourself a good chunk of time, because you have to understand, if you will just start doing questions, if you jump in and start answering questions and you realize, I'm not familiar with the details, I'm not exactly familiar, and I feel lost, that could be a sign that you might have to step back a little bit and go over material. All right. So yeah, I mean, follow us. Let us know if we can help you in any other way. But give yourself, if you want to take step 1, step 2, and you are a physician and you're not in med school, meaning you're practicing in Greece or somewhere around the world, typically IMGs or physicians that need to come to the States to eventually get into residency, I would say comfortably 6 months to a year. Ideally, that takes into consideration if your content is not strong, if you have to keep practicing. But if you're there and you're in your element and you are studying and you know your content well, it shouldn't take you more than, like I mentioned before, on the timeline. Cool? Yeah, awesome. So yeah, that's ideally what I would suggest. All right, cool. So I got a couple questions I want to answer that you sent in yesterday and early this morning. And for those out there listening, thank you. For those here now, I appreciate you all over the networks that we have. We have LinkedIn, YouTube, Instagram, and Facebook. So the questions that I have are a couple. And again, I will do these Q&As throughout the week, maybe on Saturdays, not exactly sure. You need to keep following me, set up the notifications so you get notified that, hey, I'm jumping on like you are right now, so I could answer live, because I'm not AI, I'm still skin and bones. Eventually, AI is going to take over a lot, but until then, we're still connecting virtually with each other. So please tap into what I got, 10 plus years of experience that I can answer you. So at least you can take something from this and say, well, instead of just doing what everybody else is doing, it could work for you. I need to do what's best for me. All right. All right. So I have a couple questions. What is a good score to shoot for on NBME and assessments? That's a good question. That came in yesterday evening. Okay. So any assessment you take, whether it's UWorld, whether it's Amboss has once a year, UWorld has assessments, or if you want to just take an assessment on your own, meaning you could just set up 3 blocks of 40 in your preferred Q bank and just answer them and see how you score. I would say anything over 62 to 65%. That's fair, right? Because if you're scoring consistently over 62% on random timed, that's a good sign that you know the material, right? You're doing well. And then you always want to check why you're getting questions wrong. Good. So that's what I would say. Now, when it comes to NBMEs, a little different. NBMEs are exams that USMLE organization provides for us to take to assess ourselves and say, well, if we take these NBME exams and we score over a certain percentage, we have a certain percentage that will be able to pass a test. Meaning, if we score 65%, 68% on the actual exam, there's a little addition that they have to the NBME saying, well, this individual has X percent chance of passing if they take it in 7 days or less, which is a nice addition to the NBME exam. So if you score, let's say 70% on the test, they'll say this individual has a 94% chance of passing the test on exam day in 7 days or less. We never had that before on the NBME. Here's the only issue. NBMEs are nothing like the actual exam. What do you mean? Well, that's exactly what I said. NBME tests are nothing like the actual exam. The concepts are there, meaning the material is testing the concepts. So if you do well in the NBME, that tells me, and that tells all the physicians at your school, whoever's looking at these scores, and also yourself, that you are knowledgeable of the material because the questions are shorter. So there's not that many pertinent findings that are provided to you in the scenario. But I will give you a fact. Many doctors right now, students, physicians, maybe even you, take the NBMEs, score very well, 70%, 72%, 68%, still fail the exam. Do you know why? I've said this before, I'll say it again. Think about it. Well, Dr. Stavros said that the questions look nothing like the actual exam. Yeah. Concepts are there. Okay, good. But the actual exam, well, it's 8 hours, 7 blocks of 40. The scenarios are usually very long. NBME questions, very short. So if you're used to running 5K a day, 5 miles a day, now you need to run 20, it might not work for you. A lot of students feel very good taking NBMEs. They go, I scored 72%, I have a 99% chance of passing. And they never actually stop and think, maybe I should start doing more blocks of 40, like 3 blocks of 40, 4 blocks of 40, perhaps a 5 block of 40, because the actual exam day is 8 hours, right? So be careful. To answer your question, doctor, thank you for your question from yesterday. Typically, NBMEs, anything over 65% as well. Clearly, the higher the better. But if you see that there's a 85% chance, 90% chance, 95% chance of passing in 7 days or less, you're in a good position. Good position. Good position, right? I love this question. Not your average doc 1. How to score 260 plus in step 2? I love that question. You can't answer it in 5 minutes. Okay, I'll do my best. A step 2 score of a 260. So for all of you out here to know, step 1 is a pass or fail. Step 2, you need a higher score, the better. It's 9 hours of an exam, 8 blocks of 40. You need to know all of internal medicine, and you need to review pediatrics, OB, gyne, surge, psych, behavioral science, and whatnot. So besides step 1 is just pretty much internal medicine. Step 2 is clinical knowledge. That's what's called CK. To answer your question in a few moments, because it might not help many of you because you have to see the bigger picture, or you have to know more of step 1 and step 2 and step 3. Step 2 is all about clinical knowledge. You need to know diagnosis, and you need to also know how to manage the patient. Many of my step 2 doctors, because we do private mentoring and tutoring one-on-one coaching for step 2, because it's a lot more involved with the scenarios and knowing how to answer questions. The majority of doctors that at the beginning, when they prep, they struggle is this. The top 2-3 reasons why they don't score 260 if they don't have certain guidance. The questions are very long, and they trip up on the management. So you know how to diagnose. You're like, I know what the condition is. Aspiration pneumo, or asthma, or community acquired pneumonia, right? You know the answer. Congestive heart failure, you know the diagnosis. Problem though is you know how to manage the patient, because all the answers look very good, and you have about 7 to 9 answers on average per every question, whereas step 1 probably just 5. So if you want to score 260 plus, give yourself a little longer time. Make sure you cover every specialty. Make sure you know how to diagnose, and make sure that after you do very well in your tutoring mode, and when you do a couple blocks a day, you don't go there on exam day and run out of steam. Some doctors who also fail step 2, because you need to know why people fail, is because they usually just do 3-4 blocks a day. So you want more, you want to score very high, you better get comfortable with 5, 6, 7 blocks in a day. The exam is 9 hours, 8 blocks of 40, and the questions are very long. And the answer choices are like 7, 8, 9 answer choices. So you need more help, doc, reach out to us. Love to get on a call with you to help you. 260 is a very high number, but my students usually average 245. The highest I've had somebody scored with my my mentoring was 272. So when I say I obviously I can't take it more than once, but I take pride in it, because when I work with doctors one-on-one, we work a lot. We work very, very intense with each other, right? We see each other once or twice a week. I push hard on all my doctors, whether it's step 1, step 2, step 3. So I feel good when they score, because it's like, yeah, we did it, right? So 245 is like the lowest. 272 was the highest I've ever got with somebody. Average, we scored 250, 255, 263, the average that we got. So hope that answers your question. I think it does, because that's what you need to do to score high on step 2. Watch the recording, because everything we do today, every time I have a live stream, it gets recorded and it's put everywhere on all my social media. So if you miss it, you get the information. All right. It's a good question, by the way. Thank you. All right. Next question. From another doctor. Do I have to do both AMBOSS UWorld? You guys know the answer to this one. I like this question, because many people out there, including you, watching now live or maybe watching it later, you listen to a lot of other people. Advice everyone has. Is it good advice? That's the key, right? So I can tell you the advice I provide is because I've worked with tens of thousands of students for over a decade. So when I give you advice, it's not ideally, for me, I know what I need you guys to do, but when I see the results and I see the majority of my students doing amazing with the stuff that we provide, the resources, and also the advice, I know it works. So AMBOSS UWorld are awesome Q banks. I think you could do both. Ideally, you should do both. I would start off with AMBOSS first, because they have more tools to help you get going. Diagnostic tools, attending tips, actually has a library of information, not just a Q bank. And then once you finish AMBOSS, if you need to do more practice, then you set up and you do a UWorld blocks. So you don't need to do 2 Q banks. I have many doctors who just do one. They do either UWorld or AMBOSS. They score very well. They do a couple assessment tests, 65 plus. They go and they kill the test. Other doctors need more practice. Other doctors need to see more patients. So when we say, Do I have to do more questions? Questions equals patience. I wish I knew that when I was a med student. I was always against doing questions. I didn't like doing questions. I was always, I got to sit down and do them. They're annoying. The minute my senior goes, hey, wake up. When you answer a question, it's seeing a patient, man. I'm like, huh, never thought it that way. And then I started realizing the more cases I see, the more questions I can do, the more questions I can read, the more I can apply my knowledge that I know from memorizing back then and studying nonstop. I can actually put it 2 and 2 together. So many students, unfortunately, they don't score that well after finishing one Q bank, because by the time they realize what they should be doing, they already wasted a whole Q bank and they're not where they need to be. Because I think when you do 3,000 to 4,000 questions, guys, and you set it up the right way, and you have somebody like me help you, or you watch my Q bank videos, or just have the right guidance, you only need is one Q bank to really master and perfect what you need, figure out why you're getting them wrong. But if you want to score high on step one, even though it's a pass or fail, there is still a score that isn't released. It's just there's a passing, and then obviously you can score above passing or barely passing, right? So the higher you score, it's visible on your reports. And then at the end of the day, that transitions over to step two, because you need a solid foundation step one to do even higher on step two, which goes back to answering the other doctor's question, not your average doc one who says, hey, how you score 260? You also need a solid step one foundation. So many students who haven't worked with me, who want to work with me for step two, I give them my step one Q bank for free. I'm like, listen, I haven't met you and I want you to score 260. I just don't have a year, nor do you. And I don't know how your step one is. So here's my step one Q bank library, part of the package. Take that, watch those videos, strengthen your step one if you need strengthening, and then move on to building that step two with me for 260. Cool. So to review that answer choice, that question, AMBOSS versus NU World, you only need one Q bank. If you're scoring amazing after the first Q bank, take a few assessment tests, go take the test and move on. If you realize you're doing the Q bank, you're finishing up, your scores are not where they need to be, doc, my friend, you got to do more. You got to see more patients, right? The more patients you see, the more you practice your technique, your skills, test taking skills, and also your basic science foundation. Yeah. How much time is enough to study for step one? 3 months. I can give you guys a cookie cutter answer. 3 months is enough time for anyone to study for step one. But again, are you disciplined? Can you sit and study 8-9 hours a day? Can you retain the information? Are you using the right resources? Or are you just, watching some videos, searching on YouTube every day, wasting time? So if you have a study plan and your routine and you know exactly what you're going to do, 3 months, man, and keep moving, because you don't want to waste 6, 7, 8, 9 months if you don't need to. If you have to, different story. Invest as much time as you need. But if you find yourself, many doctors, I had 3 yesterday I worked with, because the students that jump on the live sessions every Tuesday and Thursday were part of my program. I have office hours for them. So we have 15-minute consultation office hour visits that they can just sign up for. And that's awesome, because not only do you jump on a live webinar, but then I also see you one-on-one. Many of them are like, hey, I didn't know about you months ago, so I'm happy I got to know you now, they say. And before, in the past, I wasted 6 months just kind of doing what everybody else is telling me, including my school, and I'm at a 42%. Now, in 2 months, I'm like 65. I was like, good. I like to hear that. So I know what works. I just need you guys to do it, and believe me. So 3 months is enough time if you know what you're doing, right? All right, a couple more questions because I got to get going. And I am finding myself, another question. Italy, different time zones from Italy, doctor from Italy. I am finding myself memorizing, okay, and it's not really working. What do I do? Oh, so how many of you can raise your hand? You can say, you could put a smiley face, you could put a sad face. How many of you memorize? I'll be honest, I memorized a lot. Med school, I memorized all the time. I memorized. You know why I had to memorize? because no one told me anything else. No one told me, no one helped me and say, you know what, Stavros, don't memorize, man. You know, you should really learn the material. I had to memorize. We all memorized. We all literally sat there and read until we were turning blue in the face. And then later we would forget everything in about a week or two, right? So memorizing, a friend of mine brought this to my attention a while ago. He goes, Stav, you know, he's in the military, so God bless him for providing services for our country. And thank you for everyone who sacrificed their lives around the world to keep us safe, whether you're physicians, healthcare, and whatnot. So thank you all. But he goes, you know, memorization is like an iceberg, right? There's only a finite number of penguins, because he was in the South. He goes, or in Alaska, actually, he goes, there's only a finite number of penguins that can sit on one given iceberg, right? Yeah. And eventually the iceberg gets full, and then the penguins start falling off. I'm like, yeah, it makes total sense, right? We think we can memorize everything. It's impossible. So what I do is I try to teach students, whether you guys watch me live now, my students in my course, whether I work with you one-on-one, whether we do a consultation together, whether you watch my QBank videos, I teach you guys what I can, so you don't have to memorize. Medicine is not memorization. Ideally, it's clinical application. Now you have to memorize chromosome numbers sometimes and stupid little things like that. But ideally, if you can find certain techniques that you can memorize, you can understand things, you could attach like mnemonics, then you minimize the memory. So if you find yourself trying to memorize, what's going to happen is this: after reading 1 or 2 or 3, 4 pages in your first aid, I'm laughing at me. After I read 3, 4 pages, I'm like, this stuff is insane. How am I supposed to memorize 500 plus pages? Isn't that possible? Right? It's not. Because no matter what, you fill up the space of memory, and then you're like, I spent so much time memorizing last week. Now I feel like I can't, I'm overloading. I'm saturating myself to a point where I don't remember what I did last week. So memory for me, memorization is last resort. I show you guys in my videos, I show you guys in my live sessions how to use first aid to try to recall things, you know, little mnemonics and little hooks to get you to remember, to recall. Last resort is memory. So if I can't understand it, if I can't find a hack to it, if I can't find a mnemonic, if I can't make something help me remember it, last resort is memorizing. And it's very rare do I have to memorize anything. And I show you guys how to do that in my sessions, right? So honestly, memorization, a lot of us try to memorize, slam, slam, slam. You know why it works sometimes? Because when you're in your school, if you're in high school, college, undergrad, university, medical school, law school, any kind of schooling, we have quizzes and tests. They're babysitting us. So I can study and memorize things for a few weeks. But now you have a final exam, USMLE. You have all of medicine, basic sciences in one freaking test. You want to memorize all that? I've only have, I think it's 4 or 5 people in my life in medicine. This is 15 years now. 5 people that I've trained that can literally read first aid and do well. 5, because they were just a whole different level. They were just like, yo, I can just read and memorize. Very rare. Unless you have photographic memory, then why are you here on a Saturday morning, right? So that's the whole point, man. So doctor, thank you for that question. Please don't memorize. Don't waste your time memorizing. Learn to apply. Learn to apply. Do not waste time memorizing. Yeah? Awesome. If you want to work with me, guys, QBank, type in QBank in the comment or message me, DM. You get the link and you can jump on and work with me. All right, a couple more questions before I go. I got somebody. Hi, if someone is over 38, can he start preparing USMLE? I get this question a lot. Age is but a number. Yeah? Age is but a number. Who cares how old anyone is? Years ago, before the pandemic, I would say kind of hard to jump in at a or later age because your graduation is not going to be in your favor, and they want young bloods. They want people out of med school. Now it's changed quite a bit. The majority of residents jumping in now, besides typically the ones finishing medical school, the normal routine of the timeline, med school, residency. The average doctors are about coming in now, residency 35, 38, 42. I mean, they're older now because a lot of physicians are like, hey, I want to come to America. I want to work in the United States. But to do that, I got to take step 1, step 2, and get into residency. So I can answer you this way: if you have the discipline, you have the love, you have the passion for medicine. I mean, I have about 6 students now, step 1, step 2, who are over 40, and they're very experienced. They're chiropractors. One's a physical therapist. One is emergency, like EMT. So one's an attorney, actually. So they're like, hey, I want to go into medicine. So you have to ask yourself, do you have the time? Do you have the patience? Do you have the financial means? Because everything's expensive nowadays. And can you dedicate a year? Because you have to dedicate. If you're 38, either you're practicing physician somewhere else, or you have to jump back into medicine. So I would safely say 6 months to a year for step 1, step 2 together. And it's a lot of work, right? So if you're down to do all that, man, age is but a number. Jump on in, right? Jump on in. Cool. All right, a couple more guys. Hey, I'm from Pakistan. I'm currently 4th year. Have just started Pathoma. I mean, Pathoma is great. And when do you buy UWorld? I mean, I would buy UWorld right away. You know, QBanks you want to buy immediately and start practicing. You don't have a lot of time to adjust to QBanks. So I would get them right away. UWorld, if you want, by all means, go for it. As far as Pathoma is a tip of the iceberg for pathology. Pathoma goes side by side with first aid. Pathoma isn't everything. So I would use Pathoma. I would use first aid. You're presented to me UFAP. UFAP is UFAP is this, UFAP. UWorld, first aid, Pathoma. If that's what you want to use, go for it. I would use them all now. Don't use one, then the other. Pathoma just covers pathology. First aid covers everything in very, very high yield manner. So it's not easy to learn from. And UWorld is an awesome QBank. I wouldn't suggest it as your first go-to, like I said earlier in this session, just because I see the results. So if you're using a QBank to learn from, I would suggest Amboss and then UWorld. But to answer your question, my friend, start everything now, because once you're done with school, you have to take your step to come to America. So try to get that ASAP. All right, I'll answer one more question on this end. Oh, not your average doc again. According to your decade experience, what do you think high achievers have high IQ? Or is it related to more work? I mean, it's not an IQ test. So the harder, I mean, if you discipline, structured, treat this as a full-time job, you'll do very well. I have doctors who are very sharp and smart, intelligence, really high. They don't have the time to dedicate to study and do well. So if you buckle and grind, anyone can do very well on these tests, because it's just basically putting yourself in this situation to understand what the questions are asking you. So a couple of things, guys. If you're not putting time every day, eventually it slips. There's an expiration date on this test when you're studying. You can't, because I know this for a fact. I have a lot of close friends, people that I work with, who try to spend an hour a day only, and they'll never take the test because it just takes too much time. You can't do much in 1 hour a day for STEP. You have to decide, are you going to dedicate more time? And if you do so, you have to make sure you're realistic with your timeline. So that's why IQ, yeah, I mean, obviously if you're sharp and you pick up things fast, you should have a better chance, but it isn't an IQ test. I have a lot of doctors who, they're just hard workers and they have to review a lot to learn the information. Yeah, awesome, cool. All right, one more question, guys, because I got to get going. Okay, this is a good question. Let me see. I have a few right in front of me. My team sends me the questions and I look at which ones I want to answer. So I only have time for one more. So again, guys, thank you for jumping on. I have done, here we go. Ready? This is a good question. Awesome question. Legendary question. Ready for it? Let me pause. I got to drink a little coffee for this one. Total Peru, huh? Yeah, I've always wanted to go to Peru. It's cool. Awesome. Thanks for jumping on. Total Mente, 1, 2, 3. Question, ready? Here we go. I have done UWorld twice. 2 times. I hate this. I've done it twice. And I'm still scoring 45 to 50%. Okay. Ready for this one? They've wasted 6+ months of their life. I know many people like this. So I'm going to tell you the hard truth. You did UWorld twice. Maybe 3 months, 4 or 5 months each, 6 months, maybe 7, because you're working, school. 50%. What do you do now? Oh, you don't want to hear my answer. I mean, it's a good one. But many of you, and me, by the way, when I was a student, there was not that many resources. And our school loved the school. Schools did the best they could, but they said just do questions all day, every day. It's kind of like saying, I want you to go to the hospital right now and go see 50 patients a day, but no one's going to help you. There's no one's going to guide you. There's no attending physician that will help you learn the information. So you know what happens? You, medical student, go to the hospital, you see 50 patients, diagnosis wrong, wrong tests, you get in the questions wrong, you don't know what to do, and there's no one to help you. AMBOSS has attending tips. AMBOSS has things that underline to show you the key findings. So if you realize that you're getting questions wrong, you, not me, you, whoever's doing these questions, you have to sit and say, why in the world am I getting the question wrong? Now, it's easy for me to say this on a Saturday morning because I know what to do. My students know what to do, whether you work with me one-on-one or you're on my live sessions in my groups that the doctors work with me, right? The sessions that we have every Tuesday and Thursday morning, or many of you sign up for that 1 hour, and within an hour, you have more of an idea of what to do versus months of trying to find what to do. I mean, typically, it comes down to knowing why you're answering the questions wrong. Many of you, including this doctor, did it twice, the UWorld, and still 45, 50%? That's upsetting to me because now you wasted more than 6 months. You're not where you need to be. You can't pass a step. And then most likely the UWorld is going to run out. So now you're like, oh, I gotta renew it again. And then you're just doing the same stupid questions again, maybe increasing your score by 3-4%, and it's not good. So to answer this question, because I know most of you are probably struggling with this, because whether it's UWorld, AMBOSS, Kaplan, Bootcamp, all the Q banks are awesome. I'm not here telling you one is ideally better than the other. I'm giving you ideas of why they're more efficient and why you might get a higher score is because UWorld is just a Q bank. AMBOSS has everything to help you learn why you're getting it wrong. So if you're using UWorld, doctor who wrote this question to me yesterday, right? You have to figure out why you're getting these questions wrong. And here it is, ready? Here's the money. Here's the tip of the day. It's either the content, like I didn't know the material. Okay, what do? You got to go back and learn it. Well, in my generation, we had textbooks and we learned. Now everything is on video. Everything is fast. Spoiler alert, something like physio, you can't learn in 2 minutes, right? Biochem is a full semester in med school. You're not going to learn it in 3-4 videos. You could try to, and you could fool yourself, but it's not going to happen. So content, right, which goes back to learning it or trying to find a hack to it, use a mnemonic, and then watch my videos. And then at the end, hey, I'll just memorize it, but be careful. Memory is limited, right? Or you knew the stupid material. You knew the material. You're like, I knew the condition, man. All right, it's cool. Why'd you get it wrong? I read too fast. I misread. I overthought. I was too confident. I second guessed. I had the answer, but then I changed the answer, but I changed it again. That, my friends, are all test taking. So if you want to make it easy for yourself and not waste more time, because money you can make eventually, guys. You're going to make money in residency, money in as an attending. Nowadays, people make money everywhere, right? Social media and other businesses. But you can't get back time. I mean, I'm telling you, because I had the same thing. I wasted valuable time in my medical school career when I used the resources the wrong way. I just followed what everybody else told me. I didn't ask for their results. I just did what the whole mass amount of people were doing. UWorld and first aid and Kaplan. I'm like, I'm expelling so much energy, man. I'm getting these questions wrong. So this is the gold right now. If it is content, learn the material. And if it's test taking, you have to practice learning how to answer questions. Now, again, those resources are awesome, UWorld and AMBOSS, but I would say to this doctor answering this, and many of you using UFAP, if you're struggling, get out of UWorld. If you have a membership, okay, big deal. You invested some money into membership. You don't want to just use something because you have access to. It's like saying, well, these sneakers suck, but I'm going to wear them anyway. Yeah, but there's holes on them. Yeah, I'm going to wear them anyway because I don't want to waste them. No, You keep UWorld to the side. You invest a little bit in Amboss, for example, because Amboss gives you everything. Step 1, step 2, step 3. You're a DO, great. There's actually there's license exams on there too. And then later, when you figure out, because if you don't work with me, I can't help you. So if you don't want to work with me, then you have to find why you're getting it wrong. Amboss will show you, hey, this is what your thought process was. This is what it should be. This is the key findings you need to know. And then once you know why you're getting these questions wrong, then go back to UWorld. So if you're doing this, guys, if you're using QBanks, and you know what it is, I get haters all the time. I love it. I love the haters. I want more haters on my social media. I want you guys to hate me because it sounds weird. Many of you guys, what you're saying doesn't make sense. What do you mean? I got thousands of doctors who are passing every year. Oh, yeah, but my friend did it 3 times and he passed. Your friend did UWorld 3 times. How long did it take? Oh, I don't know. It could have taken him 1.5 years, 2 years, right? I can get you past in 6 months. So you want to waste 3 years of your life? Go ahead. That's why the haters I love. Because it's not that I'm saying things to hear my voice. I'm saying things that I know works. So if you want to waste a long time, do the same question 3, 4 times. Increase your score, which is a false positive, by the way, because you're going to see the same patients in the same bed in the same hospital over and over and over again. You're like, oh, man, I scored 72%. And I said, well, how many times did you do the QBank? Oh, 3 times. 3 times, okay. So how do you know that the questions that you got right, you didn't get right because you know them? Oh, yeah, I know I didn't memorize them. Okay, good. But you're depending and you're gambling with your future because you're going to walk into a board exam, which is on your record forever, by the way, and then you fail. And you say, well, I don't know what happened. I did what my friend told me to do. I did 3 times the QBank. I spent a year, and I had scored 72%. Yeah, but you did the same questions over and over again. So it gets under my skin, but I love it because I need you guys to understand the severity of things. Don't do the same things over and over again. So that was the answer to that question. If you just jumped on, I did UWorld twice. I scored 45, 50%. What do I do next? Leave UWorld, go to another QBank, and start learning why you're getting the questions wrong. Yeah? All right. All right, guys. Well, listen, I got to get going. I got a lot of stuff to do today. This is always recorded, so it's going to be posted everywhere. So I'm happy you guys jumped on. I'm happy you're here. I'm happy you're jumping on with me. If you want to work with me, just DM the word QBank, QBANK, or QBanks, right? You can send a comment. And then my team will send you a link to your way, and hopefully you could jump on next week. Every Tuesday and Thursday morning, we have live sessions in my closed community, right? My doctors who work with me. And then this is going to be week 2. So on Tuesday, we're doing biochemistry, and Thursday, we're doing cardiology. And overall, every week, we cover different organ systems. It's a structure, it's a schedule that you get access to once you join. And then you become part of the community, right? You become part of the community that we have. Step 1 students, step 2 students, study partners, and so on. So I thank you all for jumping in. Brazil, Carol Pires, very nice. I love Brazil. Brazil is beautiful. I love football, which is the soccer to me. And the World Cup, I went there in 1994 in America. I've always wanted to go visit Brazil. I will in the near future. But Brazil is beautiful. Thank you, doctor, for jumping on. Guys, I love you all, guys and girls. Honestly, I hope you understand. I'm using social media to spread the message. Whether you work with me or not, I already passed my tests, right? So if you don't want to work with me, I totally get it. I want you all to at least know what you're up against. And I need you all to understand, if you want to pursue anything, medicine, law, anything you do in life, right? You need to be guided the right way. You need to know what you're up against. So if you're taking a test or not, or if you want to invest and be a business owner, you want to go to school, you want to go here, go there, try to get advice from those who really know what they're saying. And how do you know what they're saying? They're successful, or they're doing it for a living, or you see somebody who's making a lot of money, who's building businesses. That's the person I want to learn from, right? If you're on a forum, I love Reddit, but be careful. If you're on forums and people are just providing info, advice is free. Doesn't mean it's good. So be careful, okay? That's all I'm saying. Because I get many doctors that come to me and they go, oh my gosh, I spent 6 months to a year of my life. I'm not where I am. I need help, because they took advice for free, which is awesome, but they're not sure if that advice was good for them. So I'm providing advice that I know works. Now, it's hard because you have to apply it to your day-to-day routine. And typically, if you work with me, then I can give you feedback. I can figure out what works or not. All right. So thank you, guys. You want to work with me? Jump on, DM me, comment the word QBank or QBanks. If not, either way, I'm always here for you. You'll see me throughout the week. So set your notifications on, because I'll jump on when I'm available. It could be morning, could be afternoon, could be Saturday, could be Monday at 6 a.m., Monday at 7 p.m. I can't tell you. I'm very busy with traveling, working with hospitals and students. And there's a lot more that I do besides USMLE. Step 1, step 2, step 3. So if you want to work with me, let me know. If you need rotations, we have elite medical rotation services. I'm working hard to build my network to a point where I'm in at least more than 20 states. Right now, we're in the Midwest. We have Illinois, Indiana, Wisconsin, Michigan, New York. I'm working on Florida, because these are also IMG states, and I'm from New York, and I have investments in Florida too, doctors that I know very well. So I'm working on providing the best services, whether it's internship, externship, observerships. I have an interventional cardiologist in Texas, so I'm very proud to be working with him. So if you have any questions, reach out to my team, support@usmletrainings.com or eliteMedicalRotations.com, and just let me know. Reach out if you need any assistance, because I know the services out there aren't as great. People paying a lot of money and they're getting horrible rotations. So I'm trying to give back to the community and get you guys in the healthcare system if you want to be. All right. So thank you so much. I appreciate you all. Dr. Stavros here, live Q&A. Have a great Saturday. Be safe, stay safe. From Brazil to Peru to overseas. All right. Ciao.